You're listening to Navigating Life After 40, the podcast for women exploring the joys and nuances of midlife, from career and confidence to health and wellness, and so much more. I'm your host, Ronnie J., also known as your midlife bestie, I would say. And today we're going to have a very interesting conversation. We've had so many talks on this show about menopause, the symptoms, the myths, and the ways it impacts our lives. But today we're going deeper into one part of the journey that's rarely talked about, even in doctors' offices. It's called Genitourinary Syndrome of Menopause, or GSM. I came across a video of today's guest, Dr. Tugbiyele. He was sharing a story about a patient he diagnosed with GSM, and it stopped me in my tracks. Because here's the truth. So many women are quietly struggling with bladder leakage, dryness, pain with intimacy, or even prolapse, and they've been told that it's just a part of getting older. But what if it's not true? What if there are safe, effective solutions that could give you back your comfort, your confidence, and your control? That's where today's guest comes in. Dr. Tugbiyele is a Nigerian-American physician who was born and raised in both Brooklyn, New York, and Lagos, Nigeria. He graduated from New York University School of Medicine, completed his OBGYN residency at NYU Medical Center, and trained in urogynecologist and reconstructive pelvic floor surgery at the University of Maryland Medical Center. Today, he practices in Metro Atlanta, where he cares for women facing pelvic floor health challenges. His passion is reminding women that you don't have to just live with these symptoms because real solutions do exist. Let's dive into this episode. Welcome to Navigating Life After 40, the podcast that's all about helping women navigate this exciting and sometimes challenging phase of life. I'm your host, Ronnie J., and I'll be here sharing some of my own personal experiences, chatting with experts and a few friends, and also providing some practical advice and support to help you live your best life after 40. Let's get started. Welcome to the podcast, Dr. Tugbiyele. How are you doing today?
I'm doing well, Ronnie. Thank you for having me on.
Thank you for being here. I'm going to have to go back a little bit. I know this is, part of my intro to who you are, but when I saw you talk about this important piece of information that we as women need to know about menopause, I was just stunned, and I was like, oh my God, I need you on my show. And I thank you so much for responding to me with a video and agreeing to come on the show. And so I want to spend some time talking about this particular piece because as women, again, so many women, we have not heard of this. And make sure I'm pronouncing it correctly too. I know it's GSM, but it's pronounced Geno. I'm gonna let you pronounce it.
Yeah. Thank you, Ronnie. Thank you for having me on. So yes, GSM, this is one of the conditions, when women talk about menopause, and thankfully nowadays, there's a lot of conversation about menopause now. It's not as taboo, or it doesn't have to be, you don't have to whisper when you talk about menopause and perimenopause, which I love, for women. And, let's see here. Yeah, genital urinary syndrome of menopause. And in short, GSM is, the symptoms that women feel related to menopause down below. Now, a lot of attention goes to hot flashes, night sweats, changes in mood, changes in irregular periods as they ultimately will then stop, changes in sleep quality, all of those hot flashes, all of those things, all of those things are commonly talked about. But what I find in women I've cared for in my practice over the last 20 years is that they hit their, early 50s, maybe late 40s, and definitely by the mid 50s. And then they're like, what's going on? All of a sudden, there's burning down below. It's painful intercourse where nothing new, same partner, nothing new, but all of a sudden it's hurting, it's burning. There's vaginal dryness. There's more urgency. My patients will say they can't make it to the bathroom as they used to. And they have to memorize all the bathrooms when they go shopping. Things itchy, and they've gotten cultures and it's not yeast though. And they've been treated with they've been treated with all antibiotics and it's not going away. It's burning when I pee, but it's not a UTI. All of these symptoms are related to GSM, genital urinary syndrome of menopause. And so I find that a lot of women get treated with different things doesn't help when all the while it was related to menopause.
Yeah, thank you for explaining and also for pronouncing the word because I've been trying to make sure I'm pronouncing it correctly, and so I'm on point a little bit. Um, I'm curious to know how common is this in women? I hear so many women talk about now they feeling like they're having UTIs, they're going to the doctor and they're getting these medications, but they're still having problems, which it sounds like some of what you have noticed in the work that you've done with women. But I'm curious to know how common is GSM in the women who are going through menopause changes?
Absolutely. So it definitely starts, it doesn't start immediately a woman goes into menopause. The average age women go into menopause is quoted to be around age 50, 51. So we can just say 50. Interestingly, and Ronnie, you'll find this interesting that actually they've looked at women of different ethnicities and races and how they experience menopause. And women experience menopause differently, right? So for African American women, actually, they have more urgency symptoms um, initially with menopause changes. A lot of women will notice more urinary symptoms and more bothersome hot flashes, more intense hot flashes, interestingly, compared to other ethnic groups and races. So that's pretty interesting that not every woman experiences it the same way. But yes, women will find that yes, they may start to notice the night sweats and the things late 40s. But the GSM symptoms, those vaginal, urethral, urinary symptoms, vaginal symptoms, irritative symptoms, kind of start years later after hot flashes, after the night sweat. So oftentimes women will think, okay, I've gone through menopause, I'm in my 50s now, and it's over. And then this hits, and it's like, whoa, out of it may seem like it's out of nowhere, but it's something that slowly happens. And the reason for that is because estrogen, which is the major hormone for women, starts to decrease gradually, right? In a woman in her late 40s, early 50s. And it's a gradual decrease. Of course, in women who have not had a total full hysterectomy or women who have not had their ovaries removed for whatever reason, where then the drop in hormones is drastic. But when it's gradual, women don't notice these changes related to thinning of the vagina, thinning of the urethra, thinning of the lining down there. And it's a gradual thinning that happens over years. So almost like a textbook scenario is women in her mid 50s, 5 to 7 years after her last period is when boom, these symptoms start to creep in. But it's a process that started all the while because the thinning process. And a lot of women will chalk it up to, okay, I have another UTI. They may have gotten treated. They may think it's a vaginitis or whatever other symptoms, but all the while it was GSM symptoms sneaking up on them. And then when sex then becomes unbearable, or they find they can't make it to the bathroom on time, it's like then they come and see me. But all the while, these are symptoms that they were having over the years prior to that.
Wow, that's amazing. Because I'm thinking now about what are some of like the earlier signs that we as women should pay attention to so that we can, start working on these things early versus allowing it to kind of fester and build up into something till we get to that point? Because I typically hear women say it's painful to have sex. Um, or it feels like I know Halle Berry, I don't know if you
Yeah,
remember the
I
story
saw
that
that.
she was
Yeah,
sharing about being diagnosed with an STD, and that's not what it was. And so
correct. Yep.
um, are there any early signs that we really should pay attention to as women so that we can mention that to our doctors early on rather than waiting for something to get more severe later?
Absolutely. It's interesting. Again, it's great that a lot of women, high profile women and women everyday walk of life are talking more about it, whether it's on, in different social mediums rather. But yes, I think, a lot of women should pay attention to the initial signs, just like all of a sudden there's some irritation down below that comes and goes. It's not constant. It may be there one day, it may not be there the other day, and it's irritation, dryness. Some women will describe it as sandpaper like, less lubrication. That's another initial warning sign. Let's see, burning. Or just it may just and these may be occasional on and off, and so those are things that women really should pay attention to. And if it doesn't come up during an annual GYN visit, for example, and that's something that a woman should schedule a time to speak with her provider, her doctor, her GYN about these symptoms because it may not be a vaginitis, right? It may not be a UTI. It may be the beginning of GSM, especially in women who are in that age category. So yes,
Thank you for breaking that down because you mentioned earlier about the hot flashes and the night sweats. And and I always mention this when I'm talking to different experts about menopause. And that's one of the things that most women pay attention to is the hot flashes and the night sweats. But these are other things that we don't think about, that we don't take into consideration. And maybe our estrogen is getting lower. And that's why we are experiencing certain things. And instead, we just like, okay, I'm getting older. I'm starting to experience this thing with bladder leakage, or maybe I need to practice um,
Kegel
Kegel
exercise.
exercises, yeah, to try to stop this. But I want to kind of shift a little bit to like some of these misconceptions that we have about this. And so, are there any common myths that you hear when it comes to like women who are dealing with bladder leakage or
Mhm.
prolapse or any of these other menopause symptoms that we've talked about already today?
Yeah, it's very important for women to be proactive about their symptoms because, a lot of times the body will compensate or women will compensate. Okay, maybe a little dryness, a little, irritation. So women will of course use something over the counter like some sort of a lubricant. And there's so many good options nowadays in terms of natural lubricants that have that minimize exposure to chemicals and those things. And that's really, really great that a lot of women have a lot of options. So women have options out there. But I think, if it's persistent beyond that, then it's not just dryness. It's not okay. It's something that should be looked into. Let's see here. And in terms of urinary symptoms, yes, I think prevention is better than cure. Women should be performing Kegels. I would say women in their 20s, 30s, women starting their families, in between the children, for women who have children, and even women who don't. I think that's something to keep up with in women in their 20s and 30s because that's really the best time to keep them strong. And what I see oftentimes is women in their 50s who then see me, haven't done Kegels in a decade, in years, and that they have this leak. And I know get it. I get it. I tell my patients, they'll ask me, how did you get into this? I'll say, look, I love taking care of women, and this is something that I'm very passionate about. Thank God for the opportunity to take care of women. I have a wife. We've been married for 22 years happily, and I have two grown daughters that I've raised. So I get it, and I understand women. So I feel like I've done great training, not just all through my training, but at home too. So that's what I say, and it's true.
Yeah.
But yeah, women really need to pay attention to prevention and doing Kegels and keeping their pelvic floor healthy and strong. And if there's a challenge there, that's when to seek help. The earlier the better. There's, of course, Kegels. There's a lot of information online now, whether it's YouTube or seeing a pelvic floor physical therapist, for example. If women need more coaching, more support there, in person, virtually, so many resources nowadays. There's devices that women can use to help train their pelvic floor muscles. So there are really so many more options now than ever before. And I think that's going to really be helpful for women to really be on top of it versus waiting until much later where maybe the exercises are not going to work quite as well as they would have. And then we're having a conversation about a procedure where a lot of women will prefer to not have a procedure. And no one wakes up in the morning and says, I want to have surgery. There's thankfully procedures that can help, but prevention would be best. So
I am guilty of being one of the people who don't.
it's busy.
I
Women's lives
don't
are
practice.
busy. I get
Yeah,
it.
it is.
No judgment, no judgment. I get it. There's all the things to do at work, at home,
Mhm.
like, business, career, kids, family. There's a lot on a woman's plate. And that's what I respect a lot about women. Women know how to juggle a lot. There's a lot of plates spinning, and a woman knows how to keep everything in order as best she can. I think men, we take care of one thing at a time well. That's how our
Yeah,
brains work.
yeah.
So, but one of the things that women need to do is to keep themselves a priority. Because then what I see, Ronnie, is a lot of women put themselves second and third, or, understandably. But what can then happen is that years go, 1 year turns to 5, turns to 10, right? And then it's a bigger issue. Whereas women need to make sure that they are kept in a priority while they're balancing everything else.
Yeah, yeah. Thank you for that. And you're right. We do need to prioritize ourselves first. It's something that I often say as somebody that's been in the mental health field for like over 20 years is I'm good at sharing that with other people and telling the patients or the clients that I'm seeing, like, hey, you have to put yourself first and practice self care. But then there is this challenge when it comes down to doing it for myself and making sure that I'm doing it. And of course, when it comes to Kegels, I know you can do those anywhere. But as for someone like me who has not done it in quite a bit of time, as I should, which I will, is it too late if for a woman, if they're starting to recognize these symptoms that we're talking about today, is it too late to kind of do something to slow these down or to reverse it? Is there a reversal process to this? This is my question.
Absolutely. It's never too late. I think the best time to start, the second best time to start is now and today. And so, yes, for women who are listening to this, definitely, it's not too late. You can just start. And the way I tell my patients is that the muscles a woman you would squeeze to stop the flow of urine, those are the muscles, those are your Kegel muscles, or to stop gas from coming out in an unwanted location or time. Those are the muscles that you would squeeze. It's more of a lifting, pulling in effect, more and not so much of a bearing down effect. So some women are able to do that themselves. And my mantra for years has been 100 Kegels a day keeps the urogynecologist away. And so yeah. So, we hear, so it's easy to remember. And I like my patients to come and see me. They don't want to come and see your gynecologist. No one wakes up and
Yeah.
wants to. So I like to keep
Yeah.
it light and a little laugh here that kind of, makes her feel comfortable to be able to open up and share this thing that she wishes she didn't have to have. And so, yeah, and it's also easy to remember. An apple a day. Now we have 100 Kegels a day. And so in women who are able to do that now, I tell my patients to practice once or twice, perhaps when you're emptying your bladder in the middle of a stream, squeeze, make believe you're doing a Kegel, do the Kegel, and see if it slows down the urine or stops the urine stream. And if that happens, great, you're doing it the right way. But don't keep practicing it during the time you're peeing. Just kind of now you know how to do it, but then other times, of the day you can do your Kegels. And yes, Ronnie, as you said, you can do them anywhere. Stop at a red light. Text, women are the masters of multitasking. Fit them in. You could do them all at once or spread them out through the day. I just 100 is a good now nice number to remember. No science behind it, and then they're done. But for women who find that, okay, I don't think I'm doing them well. My urine symptoms are not getting better. I feel like things are dropping and it's not really getting better. I feel pressure. There might be a prolapse, those kinds of things. Then that's where women may need to see a urogynecologist to assess their pelvic floor muscle strength. And we'll do that in a clinical exam in the office. And then there may be physical therapy, a referral to see a pelvic floor physical therapist who will coach you on doing them effectively. And some women will have one visit and they get the hang of it and they're fine. Other women may need more visits, but there's so many resources. There's online, virtual, there's devices that women can even purchase that can be inserted, medical devices gently, and women squeeze around it, Bluetooth to their phone virtually, and then women squeeze and it shows in their phone how strong their muscles are. And so women can even do that at home. So many different options and solutions.
Thank you. That kind of leads me to the next question. A patient comes to you and she sees you and she's sharing these symptoms with you, right? How do you help her choose the right solution for her, whether
Mhm.
that's physical therapy, medication, or surgery? How do you help her make the right decision based off what she's coming in to see you for?
Right. It's always been very important to me that I lay all the options out on the table. I tell my patients that it's your body's not mine, So I feel the most passionate about educating women so that women understand what's going on with their bodies, and then understand the options because I spent 14 years learning this, right? I'm trying to do this in minutes. So I lay out all the options, and generally they start with lifestyle, behavioral changes, all the things that we know to do, but it's a challenge to do. The things that can cause more urgency, for example, is like coffee, tea, sodas, artificial sweeteners, alcoholic beverages, acidic juices, carbonated beverages. All the things that are acidic, inflammatory. Those can cause more urgency. Lifestyle changes. When are we getting to bed? How much are we drinking before going to bed? Let's see here. All the, things that we're eating and or drinking that can be causing more inflammation and causing more urgency. So those are the things that, or not hold. I had a patient the other day. She holds her urine so long, and then what happens that her pelvic floor muscles then remain clenched because she was so used to holding a urine a lot and not. So there's a point of holding it, not going every time you get an urge, because then it trains the bladder and the brain to go frequently. So, but there's also on the flip side, not holding it too long, where it trains the muscles to stay clenched and causes pain. So yeah, so we talk about lifestyle changes, dietary modifications, and then progress to pelvic floor exercises either by yourself or with a pelvic floor physical therapist. We talk about medications, the pros and cons of that. Some women don't mind being on one. A lot of my patients nowadays rather not take one because of side effects and cost, but we talk about it. Everyone's different. And then there might be office-based treatments or device like a pessary to help with leakage. And then there are, of course, procedures, surgery that can help. And so, depending on where a woman is, she's either seeing me at a point where it's early and mild and she chooses an option in that direction, or if it's something that she's tried a number of conservative options and she needs a procedure, then, of course, I've been, a surgeon too for 20 years, competent, safe, top doctor in Atlanta. So when it comes to that, they're going to get great care too. But I like to lay out all the options and let her choose which one appeals to her.
Appreciate you doing that for women. I know it's been such a challenge for women to find a doctor that's really going to listen and be empathetic and compassionate and also really educate them on all of their options. I often share just kind of my experience going to different doctors and trying to navigate perimenopause and some of the experiences that I've had and not getting the support that I needed. And so think a lot of women really appreciate it when doctors do lay out all of the options, educate us on what we need to know in case maybe we need to make some changes. Maybe we need to stop drinking so much coffee or eating certain things, and we may not be aware of how that impacts our urinary system. We don't
Mhm,
know
mhm.
that.
You're
And
right.
so to have someone like you explain that to us is so helpful. And I really think the listeners will appreciate how you do that for women and also even the education you provided here for us today. And I know one question that is going to come up because they're going to ask me, what is the difference between, and I probably should have asked this earlier, but what is the difference between a urinary, I think it's a urogynecologist and a
Mhm.
gynecologist? Is there a difference or no? What should we understand about this?
Absolutely. There is a major difference. It's funny you asked that, Ronnie, because I was thinking about that. I was thinking about that one day, and then I said, let me just record a TikTok video about this, and it was very popular when I recorded that video. But yeah, so I'm a urogynecologist, so I did my training in New York City medical school, and after graduating medical school, then I went on to do I was an OBGYN residency 4 years in New York City, and then I did 3 years of subspecialty training. So above and beyond OBGYN training, I then went to in New York University, NYU. I then went to the University of Maryland to finish my fellowship in urogynecology, where I learned not just gynecology, but female urology, reconstruction, and the urinary aspects of things. So I've gotten training in gynecology and female urology, very different from someone who's just a gynecologist. Now, they've gone through residency, they graduated medical school, went through residency in OBGYN, but then that's where the training stops. So you're going to get that's what a gynecologist does. They're not getting the urology, female urology aspect of things. If you see a urologist, now some urologists will see women, a lot of urologists specialize in just mostly the men conditions. And so it's not the same as a urogynecologist where I see only women, no men, and I take care of the gynecologic and the urologic conditions that they are in the same place and they kind of affect each other. And so, seeing a urogynecologist, you're going to get the additional training, subspecialty training, and knowledge, expertise in the how the urinary and the GYN issues kind of commingle.
Thank you for breaking that down. Now, when it comes to making the decision on which doctor you should see, I know we talked a lot about the symptoms today, and some of the different exercises and things to do. How do we make the decision? I guess is what my question is. Do we decide, well, hey, I go to my gynecologist first
Hmm.
and they refer me to someone of your specialty, or do we now that we have this education out here that you're sharing on social platforms and then also listening to this show, now is it something where we can say, now I can make my own decision and make an appointment with this doctor? What would you recommend women do in that situation?
Yeah, I think it's important. I mean, it can honestly go either way. I mean, I think if a woman, I think just generally for well woman health and well woman care, yes, a woman should definitely be seeing her gynecologist, you know, um, on the whether it's annually. I think now at there are times when every 2 years or just some sort of a routine basis for just general wellness care, well woman care. They're going to talk about breast health, heart health, and as well as urinary health and GYN health at that annual visit. And if anything comes up at that point, then it can be addressed early. That's when the dietary changes, lifestyle changes, physical therapy, and the pelvic exercises can be addressed and nip things in the bud. But if it seems like at that visit, okay, a woman has tried those things and not really moving, getting better, then a referral could be made to a urogynecologist, and your gynecologist can do that. There are some women out there though who, they'll Google and they'll find me, they'll find my YouTube channel, they'll find my blog, my website, and they'll just make an appointment to see me because they've tried a lot of things at home on their own and they know to see a urogynecologist at this point. And assuming that whether they're using their insurance or not, if they are can make a direct appointment, they just call my office and make a direct appointment after they've kind of researched me. And so it can go either way, really, honestly.
Sharing it. I'm pretty sure, like just from your videos, I can imagine how the phones might be ringing for appointments for you. And I'm pretty sure when I share this in some of the groups, you probably would get an uptick from those from
Well,
patients in Atlanta.
but I want patients to and women to be
Yeah.
educated, and some women watch my videos. They get some very quick wins from that, and they leave a comment, and so that glads my heart, and that's why I do it primarily. And yes, any woman who I need to see, of course, we'll make sure that we accommodate them.
Yeah, thank you for that.
No problem.
There are a lot of women who struggle to have these conversations. They struggle to share, bladder leakage issues. They may share it with a friend, but it may be a little bit embarrassing to share it with a doctor. And I'll be honest, a male doctor. Imagine going to a male doctor and you're telling a male doctor, I'm having bladder leakage issues, or there's something going on down there outside of maybe someone who goes to a gynecologist, right? What would your suggestion be for this woman who is embarrassed to start this conversation? How would you encourage her to be open with you?
Yeah, and I get it, and I tell my patients no judgment. I understand. I tell my patients who come in and see me, I said, you're not alone. There are many women who experience this. It is common. It's not a normal part of aging, but it is common, and so don't feel like you're alone. Thankfully, there are good and safe, effective solutions and options to improve a woman's quality of life nowadays. Control, confidence, and comfort. And so the hardest part is telling the story, like making the appointment and telling the story. That's the hardest part. It gets easier after this because then we can be on the road to a solution and getting better. And so I encourage my patients as best I can not to be embarrassed. I say I've heard this once. I'll hear it again, and you're not alone. 50% of women experience this, especially women who've got children. So anywhere from 25 to 50% of women experience one of the many symptoms that you have related to perimenopause, menopause. So I tell and I'll make light of it. I say, imagine you're sitting next to two girlfriends. If you look to the right or left, at least one of them will have it. So you're not
Yeah.
alone, and it's common, and we'll nip it in the bud. So I think patients nowadays, before coming to see me, they'll have checked me out online and those things. And so I think that's not a barrier once they're in my office because they've already kind of done their research. They know that, I'm, qualified expert. I've been doing this for 20 years. They see that I'm a family man, a man of faith. And so that resonates with a lot of women. They feel they can trust me and I listen and those things. And they read the reviews of the women I've cared for over the years. And so they come and see me and they're not afraid or anxious to tell me their issues. But just generally, it is not an easy thing to talk about. It's embarrassing, and that's why I do the education, Ronnie. That's why I go online and I feel like okay, I'm going to be the champion, and I'm not a woman, but I get it. I have heard the stories of thousands of women, and this is what's happening. This is why it's happening. You don't have to live with it. We can get you better. So I think that helps. That I break the ice by being the one to be out there first, virtual, online.
Yeah. And I agree. I think that helps too, with women just seeing you talk more about this, and also the way that you respond to our comments, with just the care and concern that you provide. Because when I'm running across your videos and I'm seeing other comments and I watch how you respond to those, it's so appreciated. And it makes someone feel comfortable enough to say, let me check this doctor out so that I can see about, getting some help with what I'm experiencing here.
Absolutely. And know it's a lot of for women, trust is an issue, and I get it
Yeah.
because that's huge. I get that, and I've learned a lot. I know I said this before. I've learned a lot from being married to the same woman for 22 years. I've learned so much about women. I've learned, to listen is important. How to communicate, how to listen. And raising two daughters, it's changed me as a man. And I think that I bring that to the women I take care of in the office because I'm able to understand and empathize with everything a woman does and all the responsibilities and all she's got to do and all she's thinking about. And okay, and I tell them, I said, we got to fit you in. Let's get you, we got to take care of you. We got to find time for you. And so I feel like I'm an advocate and I get it. So I get it.
It. I love it. And I know as we're kind of nearing the end here, but I'm curious to know how do you see menopause and maybe pelvic floor care evolving in maybe the next 5 to 10 years?
I'm excited for what's happening because, in this year, the American Urologic Society had brought out guidelines. This is the first time that there were guidelines that were published for GSM, for Genitourinary Syndrome of Menopause. Very common condition. Women just suffered in silence, didn't know about estrogen cream. A lot of them were scared about hormones because they were like, oh, you shouldn't be on hormones. It causes cancer, it causes strokes and all these things and blood clots. But they didn't realize that there's doses to things and the oral medications are different from the cream, which for genitourinary syndrome of menopause, sometimes it's just a matter of either using an over-the-counter lubricant, natural, chemical-free, or, we talked about those dietary lifestyle changes, or some estrogen cream, which is a little bit that's used down below, not going to cause you to have cancer, not going to cause all the things that a lot of women associate with hormones. So finally those guidelines came out and I think there's conversations now, podcasts, YouTube, all the things about women who are experiencing this and feel open to talk about it. So I'm very excited for women over the next 5 to 10 years because I think the conversation is going to grow. I think there'll be more options for women to in terms of solutions. Some women want hormone free, some women don't, so there are different solutions. I think there's going to be more solutions for women now. It's not just going to be men's health that gets the attention. I think women's health and sexual health is going to be talked about more as time goes on. So I'm very excited about that.
Excited too. I'm excited too. I actually am in the process of working on a wellness app for
Mhm.
women navigating menopause
That's
and
awesome.
other hormonal challenges. And so that will consist of whole woman culturally competent support by a team of providers. And so I'm excited about that. I'm excited about just the work that we're doing and also just the awareness that's coming to this topic, because I often tell the story like my mother didn't talk to me about
Yeah.
menopause. And I think for a lot of women, we hear that often. No one talked to us. They didn't give us the signs. We may have, like, I noticed my mom was changing and I was like, why is she so weird now? But I did not, now that I'm in this phase of life, I understand that, oh, she was going through the change and dealing
Yeah.
with her stuff. And
Yeah.
so I think it's important for us to continue to have these conversations and provide education so that we have more out here. And then also with doctors like you speak out again, it's so helpful for us. We trust me, we are saving videos, we are passing them around in the Facebook group so other women are informed and they know what's out here. And then of course, as you mentioned, the podcast. So we're having podcasts like this now where doctors can come on and other experts can come on and just kind of talk to us about things that we need to do to care for ourselves. And also thank you again, because I always have to tell doctors this for that's, telling the truth about HRT and estrogen and
Mhm.
all the other stuff out here because it's not as bad as women think. And I'm on it and I love it. And I tell my brothers all the time, you want me on this patch. You don't want me.
I hear you. No judgment. Yeah, and I'm not a woman, but I can
Yeah.
only imagine. There'll be times I'll be, because of course I work with a lot of women, nurses, my team, they're fantastic women, talented women I work around. So it may be a time, maybe the temperature in the office is, it's hot, or I'm like, oh my goodness, is this how a hot flash feels like? Oh my goodness, is this what you guys do it? I'm like, what? So I was like,
Yes.
so it's a lot.
Yeah.
I think there should be a lot of optimism for women. It shouldn't be like, oh, menopause. No, there are things, and I think just like you said, Ronnie, I think yes, it wasn't talked about quite much a generation or two ago, but women need to know there are ways to be proactive about it, ways to for women to get her body in sync, maybe after having children, to reset things before menopause hits, before perimenopause, in the 40s, early 50s, so that it doesn't catch her by surprise, and she's going in empowered, informed, educated. Oh, it's the game has changed, so I'm excited.
Yes, I am too. Thank you so much. And lastly, for every listener that is tuning into this conversation today that you and I are having, what is something that you want them to walk away remembering?
Absolutely. That you are worth it and you're worthy, and take care of yourself and don't feel guilty for prioritizing yourself. I mean, I think there's room to take care of yourself and all the other things and all the other people in your life that is important to you. That's important to a woman, but you taking time for yourself is just as important. And get educated and seek the help that you need. And there are doctors like myself, urogynecologists who are here to educate, that can be trusted and will put you first and listen, understand. And that can improve your quality of life, your comfort level, control. And it's that second part of life, that second half of life can be just as vibrant, just as valuable. So I like to be there for women.
Thank you so much for being there for women. Again, thank you for the education that you provide to us on the social media. And also, thank you for being here and having this conversation with me today. You share so much and you touched on so many points. I just love this conversation. So
Thank you.
I can't wait to share with the listeners. And also, when I wrap up here, I think I'm going to reach out and share with some girlfriends like, hey, this is what you should be doing now. Don't be like me and do not practice your keys. Practice your keys, y'all. I'm going to do better. But again, thank you so much for being here. Yeah,
My
thank you
pleasure,
so much
Ronnie.
for being here, you all. And that is it for this episode of Navigating Life After 40. I will see you all next time.
Thank you, Ronnie.
That's a wrap for this episode of Navigating Life After 40. I hope you enjoyed this conversation just as much as I did. If you love what you're hearing, be sure to hit that subscribe button so you never miss an episode. And if you're feeling generous, leave me a review on your favorite podcast platform. This helps me to reach more amazing women like yourself who are trying to navigate this amazing life. Thanks for tuning in, and until next time, keep living your best life.